Please, we are still treating hypertensive disorders in pregnancy. Okay, so but in this particular video, I'm coming to talk about the management of the hypertensive disorders. But please, in the other videos I did or I already brought to your notice, there are management. But when you are dealing or you are learning about the management are in categories. Okay, they are in categories. Okay, so some are antenatal based, some are mother based, some are fetal based. So you take notice of all those things so that you will not feel like it's not repetition, but you should know where they belong. Okay, so in this particular video I'm coming to talk about the initial management of hypertensive disorders in pregnancy. So what happened is that the first thing, if there should be a management of someone with these disorders, the first thing you call for help. Okay, there is also ABCDE assessment that they carry out. Vital signs and urine protein is checked for the person. And they supply oxygen or supplemental oxygen if need be. Obstetric assessment follows. Uh, Start continuous maternal and fetal monitoring. You don't encourage the person to take anything until the obstetricians make decision. Okay. We also consult the obstetricians for critical care urgently. Okay. Initially, or when it happens like that, we initiate antihypertensive for urgent BP control. Maybe the person's BP is very high, so the person's BP is very high. What we do is to control the BP from aggravating at where it is. Also admit this kind of person with this condition, or we transfer the person if it is above the particular hospital the person find him or herself, depending on the high depending unit or the intensive care unit you refer the person. Because maybe if somebody like this appear in your hospital, you initiate your first aid management. If you want to refer to a bigger hospital, make sure that the things they need to manage the person is in that hospital. But if you refer the person knowing that the things are not there, you have just caused or cost the patient, because it will look like time wasting. Okay, so they also seek consent for support person involvement. Okay, concurrent communication to patients, and then support person secure IV access using large bore cannula, and then take blood sample for PET labs. That is what happened. When some things like this happen, a lot of things goes into it. Samples are taken, a whole lot to know. Or because the labs that they run helps in the detection of some other thing, or it helps to know where the next management should continue. We also administer seizure prophylaxis, that is masulfate. Okay, the loading dose. Okay, also pass urethral catheter, because when it happens like that and the person is not okay to walk, we have to secure urethral catheter to help the person bring out the output freely. We also administer IV fluid therapy and electrolyte repletion as needed. Okay, so these are some of the things we do in the management, or these are some of the management given. Bedside clothing too, it's carried out. On this note, you have just heard about the initial management given to a hypertensive uh, or hypertension disorders in pregnancy. These are some of the management given.